Good afternoon, and welcome to the Importance of Seizure Action Plans. My name is Andrea Rassiopi, and I'm Vice President of Epilepsy Services for Epilepsy Services of New Jersey. This webinar is part of a monthly webinar series that Epilepsy Services of New Jersey has been doing throughout the year of 2025. This webinar, we are so happy to be joined by Epilepsy Alliance of America and partnering with them on this much needed information about seizure action plans. I would like to introduce Cassie Corral, who's from Epilepsy Alliance of America, the Community Engagement Manager. And also joining us today is Jason Rather and Dr. Bala, who will be joining us shortly. Just want to go over some logistics for today's webinar. Today's webinar everyone has their own control panel in the upper right-hand corner of their screen. You can use the orange arrow to either open or close your panel. To listen to the webinar, you have two audio options. The audio options are either listen through your computer, or you can go through your phone as well, if that's easier. If you can't hear while using your computer speaker, you can elect to use your telephone to listen to today's session. In order to maintain the best sound quality, everybody will be on mute during the webinar. If you have any questions or comments, you can type them into the question section of your toolbar, and I will pose them to the presenter at the end. Okay, so I will give some background on some of our presenters before we get started. And throughout the webinar, different presenters will be speaking, so we will make sure that each of them are highlighted. So since Jason is with us right now, Jason Rather earned his nursing degree from Augustana University and a master's in nursing from South Dakota State University. Jason currently works as the school nurse at Whittier Middle School in the Sioux Falls School District. Diagnosed with epilepsy in 2010, he recently is working toward taking a larger role in epilepsy education and advocacy. In his spare time, he loves playing drums and spending time with his kids, all 5 of them. And Jason, we were just having a great conversation. He's such a great resource to the epilepsy world, so we're looking forward to hearing from him today. And Dr. Bala has just joined us. Dr. Bala serves as co-director of the Neonatal Neurology Program at Children's Healthcare of Atlanta and is assistant professor at Emory University of Medicine. Dr. Bala has always been fascinated with the nervous system and thoroughly enjoyed studying in medical school in Mumbai, India. She pursued an international elective at Weill Cornell Medicine in New York City to learn more about advances in pediatric neurology, which inspired her to undertake further training in the United States. She completed her residency in child neurology at University of Louisville, where she served as chief resident and received the Chairman's Achievement Award. Following residency, she pursued additional training at Children's National Hospital in Washington, D.C. Given her interest in pediatric epilepsy, she pursued a fellowship at Columbia University Irving Medical Center, where she received specialized training in the management of benign and drug-resistant childhood epilepsies. We're so happy that Dr. Bala joined our National Professional Advisory Committee in December of 2024. Just to make sure everybody knows, we are recording today's webinar, and if you did register for the webinar, you'll receive a email afterwards with a link to the recording as well. Just trying to start my slide. Second. My apologies, my computer's just giving me a little trouble right now. See, for some reason I can't get it to start PowerPoint. Oh, there we go. Oh my goodness gracious. Okay, thank you so much for your patience. So today's the importance of a seizure action plan. I want to make sure that we highlight the organizations that are a part of the today's call. So Epilepsy Services of New Jersey, our handle is epilepsynj. Our website is epilepsyservicesnj.org. And our website, which actually comes to me, so I'll be able to answer any questions you might have, is info@epilepsynj.org. We are part of a national organization, which Cassie is an employee of, called Epilepsy Alliance America, National Community Local Solutions, and many states, one alliance. Okay, I'm sorry. Just trying to, I don't know why the deck isn't full. 1 second, I'm sorry. My apologies. Okay, my apologies. So Epilepsy Alliance in America is a network of organizations that have the common interests of improving the quality of life for people with epilepsy and their loved ones. Here's all the information about Epilepsy Alliance America. The handle is at Epilepsy Alliance America, America Epilepsy, and Epilepsy Alliance. I also want to draw attention to the fact that we, Epilepsy Services of New Jersey, work in conjunction with Epilepsy Alliance America and our partner organizations to make sure that everybody is trained in seizure recognition and response. You can visit epilepsyaLlianceAmerica.org to find out more information about trainings, and there's a QR code at the end of that poster right there, the trust poster, that will bring you right to the actual training. Some objectives for today's webinar is to define what an actual seizure action plan is, explain why seizure action plans are important, identify key components of an effective seizure action plan, demonstrate how to create or complete a seizure action plan, describe roles and responsibilities of people using the plan, discuss how to implement and review the plan regularly, maybe some legal considerations, and then Cassie's going to talk about some more resources and tools. At this point, I'd like to introduce Dr. Bala. Dr. Bala, thank you so much for joining us today.
Thank you, Andrea, for that wonderful introduction. And thank you, everyone, for joining us today for this very important webinar, in my opinion. You know, clearly, most of you are here because you either have a family member or a caregiver that you're taking care of who has epilepsy, or you are a provider or take care of children in school or in the community with people who are dealing with epilepsy, adults, kids, everyone. So you come across someone who's having a seizure at some point in their life. And the goal for today's presentation essentially is to really just hone in on the basics of management of an acute seizure and how a seizure action plan can help with that and can help provide good care for our children, young adults, infants, adults with this condition. Before we dive into that, I want to talk about how common epilepsy is. I think you know, it is still not as commonly discussed as, you know, stroke or heart attack, but it is very prevalent in the community, and about 3 to 3.5 million Americans have epilepsy here, and more than 65 million people worldwide have epilepsy, out of which a huge number is in the young age group. So about 500,000 children suffer with epilepsy or have an active epilepsy. And we diagnose about 45 to 50,000 new cases each year for epilepsy in children. And when it comes to, you know, overall, like statistics at a smaller level, 1 in 26 people, right, can have epilepsy. So or can have a seizure at some point in their lifetime, and that is 1 in 10 people. So when you hone down the numbers, it is quite prevalent. So you might come across someone who has a seizure in your day-to-day, if you're in a grocery store or in a mall, because it does happen, or in a park, it does happen so frequently. So amongst all the neurological condition, it is more common than cerebral palsy, Parkinson's, muscular dystrophy, or multiple sclerosis. So it's really important we learn how to talk about seizures, how to manage seizures. And my next slide, I'll talk about seizures. So epilepsy essentially is a diagnosis in someone who has an increased tendency of seizures. So seizures are the crux of epilepsy. But what is a seizure, right? Seizure is your brain generating a symptom depending on where the abnormal electrical activity is triggering in the brain. So our brain is very complex. I call it kind of like a walnut shape, many folds and crevices. Right side and left side should look the same. Sometimes there can be different reasons why it gets injured, whether it is misfolding in the brain, whether you've had an external factor like a stroke or an infection or a trauma. So different areas in the brain could get injured accordingly, or some genetic mutations where the neurons have just not developed as well and the connectivity in the brain is affected. So you could have seizures come or get triggered from different areas of the brain. And the seizure is the clinical manifestation of this triggering or firing or misfiring of these cluster of neurons in different areas of the brain. Depending on where they are located, the symptoms, the seizure can look very different. So in some people, the seizures can only be as simple as heart rate increase, breathing difficulty, flushing, turning blue, pale, going limp. In some, it can be just abnormal sensation in the body that starts in one hand, goes up marching to the shoulder or to the leg and just stays there, but then can sometimes get more prominent with more motor components being involved, with shaking, jerking. And, you know, of course, the big ones that we see on TV are the big tonic-clonic one, which has full body stiffening, tonic stiffening, followed by clonic rhythmic jerking. Maybe we'll have some vocalization with that, with loud sounds, can have some behavioral change, like, you know, breathing abnormalities or behavioral changes with that. In some people, seizures can be very subtle, that they have an altered behavior where they are partially responsive to the commands but not completely responsive. They might just keep going in circles and not be able to follow commands, not be able to talk back. They can hear you, but they cannot talk back. So it can look very differently in different people. And so it's important to understand what the person that you're taking care of, or your family member, what kind of seizures they have, because then some of them can be a seizure emergency that they last very long, requiring emergency treatment, and some may be very brief and have a quick brief recovery, which may not require emergency treatment. So it's very important to have that discussion with your caregiver. If you have someone who has epilepsy, hey, what kind of seizures are these? Are these focal? Are these autonomic? Are these, generalized tonic-clonic? Are these the absence kind of seizures? And so based on that, you can modify your seizure action plan and make it very individualized and personalized. So in terms of seizures, I already touched on this, but who is mostly at risk for having seizure emergencies are children, especially infants, sometimes as young as 6 months of age with high-grade fevers. They can have their first ever seizure, febrile seizure, that can look very, very concerning. Infants, babies can go limp, can stop breathing, can turn blue, unresponsive, and then the seizures also tend to be much longer in children. And as you get older, in general, the neuronal excitability comes down, and overall seizures are not as intense or not as prolonged in certain cases. Some adults who have chronic epilepsy do still tend to have very prolonged focal or generalized seizures, so they can be at risk as well. And in some cases, It may be their first ever seizure, and the seizure is provoked from some sort of incident, whether it's a stroke or a brain bleed or intoxication from any kind of drug or alcohol withdrawal, encephalitis, new brain tumor diagnosis. So the seizure can be their first ever presenting symptom that there is something new that's going on in the brain that is acute and that's different from baseline. So keep an eye for that, and somebody who does not have epilepsy can also have a seizure, and then we need to evaluate accordingly whether this person needs additional testing or not. So when it comes to management of seizures, you know, they can look very scary. I always feel that when it's your own person, you care, your child, your spouse, your mom, dad, your family, then they're having a seizure, because it can look dramatic, even if it is a subtle one where there's just loss of awareness. It can look very scary because there is a complete change in their personality. And what do you do? A lot of times you're wondering, how do I help this person, what to do? So there are definitely some guidelines on how we can help. There are phases to a seizure. You know, seizures can have aura. Sometimes they come unannounced. They have more intense phase, and then things do slow down. So, but we will talk about acute safety and care. You know, first thing first, make sure the patient is in a safe place. So if they're standing, make them sit or lay down on the side, depending on what position they are. And Jason is going to go more in the acute management piece, but essentially the idea is to get them to a safe place. A lot of seizures can have secondary generalization with tonic-clonic activity, which can be associated with vomiting or choking or gagging, and so that's the reason why we want to turn them on the side. And then, like I said, if a lot of seizures stop on their own within the 2-minute mark, but if it's lasting longer than 2 minutes and almost 5 minutes, then very likely that the stopping on its own is not going to happen, and that they will need a rescue medication. And so that's where seizure can become an emergency, because if you don't treat it in that time frame, there is a chance the seizure can be very prolonged, and then you will end up in a status epilepticus, which is essentially a seizure emergency, where the seizures can be very prolonged if not treated early on. And the prolonged seizures then lasting more than 30 minutes can have additional impact to the brain, and so that's why we want to treat it. There are several different treatment options for rescue management of epilepsy, and I'll discuss that in the next slide. And then, of course, what's most important is your chronic management of epilepsy, right? The goal as a provider for me is to get you at a place where we are managing your epilepsy, that you don't end up with these prolonged seizures, that we have to deal with less and less seizure-related emergencies, that we can manage and control prolonged seizures at home, that they don't go into status and you don't necessarily need to call 911 or end up in the hospital. So the chronic management of epilepsy is going to definitely help overall in your seizure burden, seizure intensity, seizure frequency, the recovery after a seizure. So if that is in line, you know, and you're getting good chronic care and you're finding the right combination of medicines, whether or diet or surgery, whatever it may take, so that will overall improve your quality of life by reducing the number of seizures and intensity of seizures. So coming to management of acute seizures, right? How can we manage a seizure? There are plans that have been developed, and it's called Seizure Action Plan. It's just like people who have asthma, they have an asthma action plan. Kids in school who have asthma have asthma action plan. So that's also an emergency, right? That's a respiratory emergency. Seizure is a neurological emergency. So the seizure action plan is a very personalized, individualized document that essentially provides instructions to a bystander or, you know, school nurse, caregiver, employer, wherever you may be, on how to manage your seizures, because obviously when you're actively in a seizure, you have no control and you cannot self-manage. And so this plan should go over all the details about your epilepsy, details about what kind of seizures you have, and what to do, what kind of medicines to use. So people with epilepsy should have this plan, or and then it's very important in children, especially school, where they spend quite a few hours of their day, and then of course for individuals who rely on others for care, whether it's at home or at work. If you're working, it's good to have a seizure action plan there as well. This is an example of a seizure action plan, and this is, made by Epilepsy Alliance of America. This may look like something that you have, but there can be different versions of the same kind of seizure action plan depending on where you're located. There are some additional examples of seizure action plans on the American Epilepsy Society website, Epilepsy Foundation website. So there are several different organizations. But all these plans have a few things in common, right? Like the first thing is going to involve the name of the person who's this plan belongs to, their medical, their identification in terms of their date of birth, and then what kind of epilepsy they have, or what kind of seizures are the ones that can become emergency or that we need to treat urgently. So the seizure action plan. In addition to that, some plans have, like, you can write about their triggers, so there's more knowledge to what kind of, what could have triggered these seizures. And then there are different zones to a seizure action plan, just like your asthma action plan. So like a green zone, yellow zone, red zone. So green is essentially just providing care, urgent care, making sure the patient is safe, again, on the floor or on the side. You can support their head, don't put anything in their mouth, monitor it, time the seizure, help them, support them. And then yellow is when if the seizure is still lasting long, then what their typical time duration is. Then you use a rescue medicine, and there will be instructions on that seizure action plan on when to use, at what time. So there could be someone who have a kind of epilepsy that any seizure they have, if not treated immediately, they'll go into, or they have a tendency that they always only have prolonged seizures, and they go into status epilepticus often. Or there could be someone whose seizures stop on their own at the 2-minute mark. So really, the seizure rescue treatment is going to be very individualized based on the patient. Like my patient with Dravet syndrome, who I know is going to is very high risk of status epilepticus every time they seize. My rescue plan involves use of a rescue medicine at the onset of seizure. And then there are some others who have like a focal epilepsy, who has seizures at maximum last 1 or 2 minutes at baseline and never really generalizes or never goes more than 5 minutes. And I use a rescue medicine at 5-minute mark. So that has to be very individualized. Rescue medications are of many different types, and they can be given through several different modes. You have rectal, you have intranasal, you have intramuscular. So depending on which it is, it will be individualized. So you want to add that to the seizure action plan, and if that is not helping, then of course it's your red zone and you're calling for additional help, because this patient is now then in status epilepticus that needs to be treated more urgently and probably needs hospitalization for IV medications and probably trips. So why are seizure action plans so important? Again, because it helps that patient's epilepsy be known to others who are caring for him, so that we can get the right kind of treatment. It ensures consistency in care, so there is guidance on when to give medicine and what dose to use the medicine. It also helps non-medical providers to take action who have probably never dealt with this, and it will be very helpful that they can go through it and provide care. And again, the idea is to prevent status epilepticus, and so anyone, it helps in delaying care or giving inappropriate responses. So I touched on this briefly, but to go more in details, what are the key components? So again, very individualized, right? So the name and emergency contact of the patient should be on it. The medical provider's name should be on it, who signs off the seizure action plan. So it has to be written by a provider that knows the patient. It could be their PCP, it could be their neurologist, it could be their epileptologist, whoever they get care from. Ideally, it should have details about their seizure, because again, there are certain seizures that require rescue. They may not require rescue depending on what the patient has. So you want to write down that they have absence, tonic-clonic, but you use a seizure action rescue medicine for tonic-clonics only, or whichever type that for them can be problematic. Then the triggers are very helpful to know, what could trigger their seizures if they have. And then first aid, basics on how to manage, like ABCs, airway, breathing, put them on the side, all that. And then when do you administer? So now you're coming into a yellow zone. Really, if the timing lasting more than 5 minutes, or whatever the patient needs, you want to go ahead, give the medication. Medicine should have the name, should have the dosing, because these are all individualized weight-based dosing. So the same dose may not apply for all. And how to give them, whether it's rectal, intranasal. IM is still not available for use, but it's still being tested out of the market. With the industry, but the 911 or emergency services definitely have IM options if we need to use it. And then what to happen after a seizure, so how long it takes to recover from a seizure, how to support that recovery, any special considerations that we need to know, like, okay, this child can have hemiplegia after a seizure, and that's normal. It's not like, it's called thoughts paralysis. It's happened before, does not need to go to the hospital for it. It should get better with time, or has communication difficulties after a seizure, and recovery can be long. So so in terms of how to fill out a seizure action plan, sit with your physician. It may vary. Your school may have their own particular seizure action plan that they like. There are certain, state regulations on what's needed on a seizure action plan. Some require parent signature on it in addition to the provider signature. Some don't. So whatever is required at your child's school or your institution where you work at, where you live, where it's usually these places will have their own requirement, or they say they'll use a standard seizure action plan. And when you have a standard, you have to again sit down with the patient, the caregiver, really try to hone down on what needs to be treated, because you don't want over treatment or under treatment, because seizure scan looks so differently in different individuals. So it's very important to write down the type of seizure that needs to be treated, at what time, whether it's immediately at seizure onset, or whether it's 2 minutes after a seizure, or it's 4 minutes. Typically, a lot of people go by blanket 5-minute mark, because a lot of seizures do stop within the 5-minute mark on their own. But so that can be on it. Now, it should be, you have to make sure the medication doses is appropriate. These doses are all weight-based dosing. So depending on the weight option, you want to pick the right kind of dose. In some patients, there are, these medicines, seizure rescue medicines, they've tried, say, diazepam rectal gel, but it doesn't work as well. So you can switch to Nasalam. So if there is something that does not work, you can put it under allergies, and make sure you are keeping that updated medication with the updated medication dose on the seizure action plan as most accurate. You may need to update it every year. It's especially important for school calendar years. They require a new updated seizure action plan, but it's also best practice to update it every year, because seizures can change, like I said, with your chronic management of epilepsy. Hopefully things are getting better, now, or you could have a VNS implanted, and then you have a magnet that you use for your seizure rescue. So you can add that to your seizure action plan as well. So these are the kind of treatment options that we have that you could use at home or in the community, at school, or anywhere else. These are all called drugs that belong to the benzodiazepine category. So these are quick-acting medications that work on inhibiting that seizure activity in the brain. All these are kind of similar medications. They're all part of the same family, but they still act differently. Some work on GABA A receptors better, some work on GABA B receptors. So it's quite possible some individuals may have better response to one medication versus the other. But so you're aware, there are intranasal options now that are generic or come in pre-filled boxes. So you just need like this kind of a nasal spray that's dose based. It has the right amount of dose based on what your prescription says, whether it's 5 milligrams or 15 milligrams, and you have to insert it in the nostril. So you can actively do it while the patient is actively seizing. If they have come back to themselves and you're instilling the medicine after the seizure is over, it may cause a little bit of irritation in the nose, so it's probably best to give it during the seizure. But it can be used as a rescue treatment in case somebody is clustering. So an individual who's having multiple seizures back to back every few minutes can still take the nasal spray and helps with the clusters. Then you have the rectal diazepam, which is a very age-old formulation for medication that you can instill. Again, very weight-based dosing between, starts at a 2.5 milligram gel all the way up to 20 milligram gel. So it's a lot of different doses that are available. If in older kids, teenagers, adults, sometimes we've also used buccal clonazepam. So it's like a disintegrating tablet that will dissolve rapidly in your mouth and again get into your bloodstream and try to stop the seizures. There are auto-injectable muscular IM solutions as well as buccal, like oral solution films that are being developed for diazepam, and hopefully are going to get studied soon and may be available in the market. These medications, rescue medicines, are expensive, but majority of them are covered by insurance. If it's not covered by insurance, your provider can often get it to be covered by writing appeals and PAs and things like that. Valtoco was previously only available for 6 and above, but just this few months ago, they updated the Valtoco for 2 years and above use. So that's another additional intranasal option for younger children, where sometimes rectal can be too tricky to give when your child is actively seizing. So these medicines are all widely available in every pharmacy. Implementing a seizure action plan in school, really, once you have the documentation, you want to take it to the school nurse, and every school has programs in general for training, but I think, I'm sure Jason will add more to it, being in this field, but it has all the details on how to give the medication if need be and what dose, based on what your school needs.
Thank you so much, Dr. Bala. Jason, if you can jump in and talk to us a little bit more about seizure action plans in the school.
Yeah, that'd be just fine. So hello, everybody. My name is Jason, and just a little bit of history here. So I've been a nurse now for 25 plus years, and now going on 9 years in the school district that I work in. But because some of this, especially with the action plan, is going to go back and forth a little bit, just so you know, my first witness seizure was 15 years ago in October. My wife and I were just having a discussion at the bedside, and I went down. If you can't tell by the end of this, I'm kind of a goofy person. She thought I was just messing around until she rolled me over and realized I was having a tonic-clonic seizure right in front of her. Didn't know what to do at the time, so was into the doctor the next day. And on Monday, we were having the MRI to make sure that there was no brain tumor, which there was not. But when they did the EEG, especially, it started with one tech that was watching all the monitors. And when I woke up from my nice little nap, there was one tech and like 8 students. So the minute that I saw all those students around there, I knew something was wrong. Usually a tech doesn't call somebody over to say, hey, come look at this normal thing. And so that's where my journey kind of started. And so now being in the school district, I'm able to take what I know as a person that has this, plus all the information that was just presented to you before on these, and kind of put it all together just to kind of best help all our students and staff. So the one thing for this, especially as far as implementing a seizure action plan at school, staff training definitely comes first, regardless of that action plan and all the details on it. As she had indicated before, there's definitely just some standardized procedures that you do with all seizures. Considering that since I've been here at my school, we've had 7 seizures now that have happened that have never had a diagnosis before. So these were students that went down right away in front of maybe an educational assistant, in front of a teacher, in front of a coach, and there was no documentation. So that staff training starts with just here are the basics of epilepsy, here's the basics of seizures and how you take care of them. From that point on then, you find yourself working with your provider after that to make sure that everything is set up. Just like she had said before, that all of this is going to be individualized to that person, to the type of seizure they have, to the weight that, that they have, everything like that. And so every person that I have in my building right now is completely different. And so that's when that action plan really comes into place. Throughout all this, one of the biggest keys are parent communication. And so one of the things that we were talking about before getting on the conversation today was, wow, Jason, what is it like for you before school starts? And I'm like, well, it's crazy. For the 2 weeks leading up to school, I am taking a look at all the healthcare needs of my students, and then I am prioritizing the ones that I need to call. Our students with seizures and epilepsy are at the top of the list usually. When was the last time that they saw their physician? When was the last time they had any changes go on? So that's one of the first phone calls I make to see, is there anything in this action plan that needs to be updated since they were in 5th grade, 6th grade, 7th grade, whatever it might be. And a lot of times over the summer months, there's a lot that has changed. We've switched to this med. We have a new rescue med. When I started here, it was a lot of rectal medication. Now it's nasal instead. And so these things are changing constantly. A good example of this for myself here as well is as of 6 months ago, I was taking 20 pills a day to manage my epilepsy. We are slowly titrating the one common one, Depakote, down to start a new one, but this is like every 2 weeks. So even here to my coworkers, I'm saying, hey, this is going on for me, just know these are things to expect. Part of the parent communication might be cares from the physician, but it might be simple things too, like, just so you know, if we do make a dosage change, my child is probably going to be sleepy for a couple days. It's just going to be how they're going to act. So rather than the teacher going, wow, what's going on in the classroom, they kind of know, you know, okay, Jason let us know there's a dosage change going on, just kind of watch for these things to happen. Rescue Med Administration, next one that's down there. This has been, so many changes have gone on in the last 5 to 10 years for these. That in here, at the district that I'm in, high schools and middle schools, we each have 1 nurse all the time. In elementary school, they may have 1 for half a day. So we have med aides that are trained. They can administer these as well. And then so beyond the class that they take, there's also at the beginning of the year, hey, come on back and visit Jason. We're going to go through this, this, and this. And here's the other epilepsy emergency meds that are going to be here in the school for this year that we want to make sure that you know how to administer as well. And then the other one, like I said, any other details throughout this, every one of these, so many times, one of the biggest things, and this is going to go back to staff training, had a student here a while ago, and she's doing very well, just before I tell the story, but she had 2 seizures in the classroom, and I was not notified until afterwards. And when the action plan was there, the healthcare plan, everything was there, but what those look like and that fear that can put into somebody who's never seen one before, it can be very, very daunting. And in this case, the teacher thought, well, what did I do that caused this? She felt very guilty in the situation. And so sometimes staff training goes above and beyond all the ABCs, and here's all the medical parts and everything else. And it's also the reassurance just to know that in this process, like in my brain and the other kids' ones, these are going to be things that can just happen. And so you just kind of need to follow this so we know right away. All right, go on to the next slide. All right, who should you share your seizure action plan with? Well, obviously in this case, one of the keys is teachers. Now, in elementary schools, middle schools, high schools, it can be really easy to say, well, they have these 8 classes a day, there were this teacher twice a day. But the nice thing is everyone in my building needs to know what's going on with these students. They could be walking from class to class. They can have a seizure that takes place in the hallway. They can have one that takes care in the lunchroom. And so for these students, this is something that is building-wide something they need to know, rather than just those 8 teachers for those 8 periods a day, because so many things can be changing. The nurse definitely with this, and here that'd be me. And then the nice thing with this is that action plan is located on our computer system. It's also located in my office just to the right in a binder. And then as we have substitute nurses come in, there's also a little folder just to say, here's what your day is going to look like. By the way, here are 5 to 20 different students, very, very specific that you need to have kind of keep your eye open for. And those are my seizure students a lot of the times. Coaches is another one. Here at the middle school, we do have coaches that are teachers within our school, but a lot of them come in from elementary, high school, just because it's something they want to help out with. And so how to take care of that person in the coach setting, whether it is sports, dance, band, whatever it might be, then this is something that they need to be aware of at all times. Coworkers is huge. In this case, I'm going to relate it back to myself. From the minute that I started here at school, I let everybody know, hey, this is what goes on with me. This is what they look like. And here's what my action plan looks like to take care of myself. Currently right now, because of all the changes that have been going on, they're very aware that, okay, every 2 weeks, this med change is going to happen. This one's going down, this one's going up. Jason might be a little sleepy, for a little while, and different things like that. They know all the numbers to call. They know how to take care of me, and they know not to, take pictures and put it on social media and stuff like that too. And then the last one is caregivers. In my household, all my family knows how to take care of me, as well as my extended family as well. The most interesting one for this is I was thinking ahead this morning to, okay, I'm going to be presenting this to a lot of people. A lot of people are going to watch this on recording. Am I really following what I preach? And I was taking my daughter to school today. I'm like, hey, if I have one of these, what do you do? And it was like the coolest thing. She's a sophomore in high school, but she really went down everything to say, okay, this is what I know to do to take care of my dad. And so that was pretty impressive, especially coming from a person for the first few months where there was so much change going on that that action plan almost wasn't a priority. It was more, there's so many changes and everything. We almost kind of forgot about it. And so the teacher, the nurse, the coach, you can definitely be that advocate to say, okay, all this is new, or you've had this going on your whole life. What is the action plan that we have in place just to make sure that your student, your child is best taken care of at all times? So there's a lot of pieces that go into this. So it's just as much as you're sharing this to everybody that's listening there in that slide, you need to make sure any of those people can be an advocate as well to make sure that it's in place and it's up to date so you can take the best care possible. Seizure action plans beyond the classroom. Now, the ADA is listed there and everything else. One of the biggest ones for me is that so many of my students, it's easy to say, well, this is what I have set up at home. This is what I have set up at school. But what happens if this seizure or anything takes place anywhere else? For myself, it's located on my phone. And for a lot of people, they understand that there can be emergency ID button, different things that are listed there. Is it going to be perfect? Probably not. But for me happening anywhere else, that's something that can show up really easily as well.
Yes, agreed. Thank you so much, Jason, and thank you, Dr. Bala, as well. Both of you shared such critical information. And I think Jason brings up a really great point that oftentimes when we're speaking about seizure action plans, we do hear a lot about how they are related to the school setting, the classroom setting. And that is a very important aspect of, understanding how to implement a seizure action plan. I have a child who has epilepsy. He was diagnosed at age 9. And so we obviously have had to do this often with providing the seizure action plan to the school and all of the relevant people at the school. And he is now rapidly approaching the age of 18. And so we're moving into a different part of life where he now has his first job. He's looking to be completing high school this year and moving on into what life has next for him. So this is actually very relevant to my personal experience, and maybe it is to those of you who are listening right now, to some of you, that moving into the workplace and other things, how do we implement the seizure action plan and some other items? And so we mentioned the Americans with Disabilities Act because it is a very important thing to be familiar with if you're a person with epilepsy or you're a caregiver to a person with epilepsy, that everyone has workplace rights. Everybody is protected under the Americans with Disabilities Act. It grants equal opportunity as well as a reasonable accommodations in the workplace. And it also protects employees from workplace discrimination, which all of these things can be very important to someone living with epilepsy. Some reasonable accommodations that an employee with epilepsy could potentially request from their employer could be things like flexible schedules, accessible work environments, making sure that those environments are seizure safe, which could include a lot of variables depending on what type of workplace you're working in. Access to emergency medication. We've touched on the importance of rescue medication and the role that they play in seizure management, potentially remote working options, and then personalized emergency response protocols as outlined in the individual's seizure action plan, which again can look different based on each person's diagnosis and their experience with epilepsy. Protecting the employee from workplace discrimination is also very important. Every employee has a right to confidentiality, freedom from retaliation, freedom from anything in the workplace that could potentially be rooted in epilepsy stigma. And then when we talk about these types of things, it's difficult to talk about this without also mentioning disclosure, which disclosure is a very a personal experience. People have different feelings about when to disclose or even if to disclose at all. And it is important to make sure everyone's aware that you are not obligated to disclose your diagnosis. However, if you are requesting workplace accommodations, then disclosure will sort of go hand in hand with that. And again, the individual does get to make the decision as far as what does disclosure look like for you? How much are you disclosing? Is it a partial disclosure, just enough to be able to inform and request accommodations? Safety is another important consideration to make when we talk about the idea of disclosure, because obviously your safety is very important, and open dialogue is very key to setting those clear expectations. So open dialogue between the employee and their employer is going to go a long way in ensuring that you have a safe and discrimination-free workplace, and that if you do not, that you understand what your rights are and how to respond in the incidents that something of that nature would be something that, if they're keeping accommodations from you or anything else that is, infringing on your safety and your personal rights within the workplace. So I want to mention that Jason also brought up an important point about how we are carrying our seizure action plan or communicating our seizure action plan. Again, when we're talking about it in the school and classroom environment, we tend to think of a form. Jason even mentioned having binders and having actual paper forms for different students that have these seizure action plans on file. And when we become adults and we're in different environments, workplace environments and that type of thing, that is obviously still always an option. I don't think paper is going away, even in this very digital and fast-paced world that we all are living in. But because there are other options, we like to at least mention that there are a couple other options that you may want to have in addition to a paper seizure action plan. Many of us carry smartphones now There are a lot of different options when it comes to smartphones, as far as the health app that comes kind of standard on a lot of iPhones. There are also some other apps available through either the Apple App Store or the Google Play Store, different options that you can really take a look at and see what works best for you. Some people have even changed the wallpaper on their phone to say something along the lines of, I have epilepsy, or perhaps a QR code that could direct someone else to this information that's important in case you were to have a seizure out in public alone without someone else there to kind of communicate your health needs to somebody. We also, on Epilepsy Alliance America's website, which is epilepsyallianceamerica.org, we have a page where you can learn about a medical ID, bracelets. They come in the form of bracelets, necklaces, sometimes things that even just are a sleeve that would slide onto your smartphone. These are QR code enabled, so that anybody could scan the QR code and you can set up your profile personalized with your information, your doctor's information, emergency contact information, seizure response information, medication, so that all of this information is readily available to anybody else who may need to access that information, whether it's paramedics and first responders or simply bystanders. So if you visit our website, I would encourage you to do so, because we do offer a voucher program for that to help offset the cost of those items. And there are a variety of items that that may be helpful to you. So we would love for you to visit that and see if that's something that would be helpful to you. And Epilepsy Alliance America is also the managing entity of the Seizure Action Plan Coalition. So the website is right there. Would love for you to visit that website, because we do offer a lot of other tools and resources that are helpful on there. We have a variety of different, Dr. Bala mentioned earlier, there are different templates for seizure action plans. So there are a variety of seizure action plans through different organizations that are linked there on the Seizure Action Plan Coalition website. We have them in a variety of languages. So if English is not the language that works best for you, we do offer them in other languages as well. We also have a virtual backpack of sorts. It's kind of our back to school checklist. So if you visit there, there's a list of different items that can help you kick off the school year. I know that some of us went back to school in August. Some of us just went back to school within the last week or two, but the beginning of any school year is always a good time to sort of reevaluate your routines, your habits, the communication of your health needs. So there's a lot of different tools and resources on there to help you do that. And through the coalition, we do celebrate Seizure Action Plan Awareness Week every year, which takes place the second week of February every year. So we will be looking to do that in the second week of February. If you're not following us on social media, please do, because we do share a lot of helpful information, especially during that week, but throughout the year as well. Epilepsy Alliance America also offers seizure action plan, or excuse me, seizure recognition and response trainings. And we do have a couple different options there for different audiences. Our school and personnel training is great for anyone who is in the position of caring for students. We also have a more generalized training that really can be adapted to any audience. And we recently have launched one for law enforcement professionals as well, which could apply to police officers as well as school resource officers that are on school campuses, or campus security officers on college campuses. There's just a lot of different information and different ways that that can be applied to make sure that people with epilepsy are safe in whatever environment they may find themselves in, whether that is school or any other environment, anything else that they move into once they're past the school stage of life. But I want to thank everybody who shared all this information today, and Epilepsy Services New Jersey as well for coordinating this webinar. And I will throw it back over to you, Andrea.
Thank you so much, Cassie. So I'm going to keep the screen up. I think it's great for everybody to know what to do in case somebody has a seizure. So please join our on-demand training. You can use that QR code there. So if you have any questions at this point, please type them into the question section. We do have one already, so let me just pull that up. If it's a first-time seizure with no known history, do you call 911 every time, even if it lasts less than 5 minutes?
Yes, I would advise it. If it's not a known history, it's better to get evaluated. So 911 would be appropriate.
I actually have a question for you, Dr. Bala. How How often do you actually hear from school administration or the school nurse with questions about a seizure action plan?
Yeah, it's not often, but there are certainly some cases that we have, some more questions that kick in. It really is dependent on the patient. So somebody with chronic epilepsy with frequent different seizure types, especially in kids who have Lennox-Gastaut syndrome, who tend to have more frequent seizures, it's hard to distinguish which one needs emergency treatment or not. It's good to have that dialogue with the provider to ask for some clarity if the action plan is not very clear. In some children who are have a VNS, like how to use the magnet, sometimes that can be a question that comes in. And then there are some other non-epileptic events too, and I think the schools, it's getting more and more common these days for the functional neurological disorders that do look like seizures but may not be epileptic seizures, and they are managed very differently, and so those have a very different seizure action plan or action plan. And I often have communications with school nurses about that, because they don't need rescue medication, they need a completely different treatment plan. So that program, that plan for that patient would be very different.
The next question for you, Jason. Do you recommend sharing the seizure action plan with the teachers and staff?
Say that again, sorry?
Do you recommend sharing the seizure action plan with the teachers and the staff in addition to the school nurse?
Yes, absolutely. Especially because most of the time, I mean, they're going to be the one that's going to be immediately there. In the building here, I can't really put a time limit on it, but that seizure occurs, they start timing, they get them to a safe spot immediately. And in that same amount of time, they're notifying me, and then I'm grabbing everything I need and running to that room. And so to know exactly that, the proper care is up front, then those teachers need to be aware of that as well.
Wonderful. I just want to also add that obviously we're talking to people throughout the nation today, so it's important to look into the laws in your own state as far as what the school nurse can do, what teachers are allowed to do. So please look into that. I know we got some specific questions about states, so I want to make sure that I put that back on the state law because that really varies throughout the nation. Any lasting words, Jason?
I think the biggest thing just for everybody, from a person that is experiencing this in my life and also taking care of so many little ones that have this, is, please be that advocate for them. Please be that one that is, if you see something that is different than is on that action plan, tell your nurse so they can talk to the doctors, they can talk to the family. But communication is so key in all of these to make sure they get the proper care.
Right. Yeah, a couple last closing points. I think, of course, you have the seizure action plan, but make sure your medication is updated. Make sure the nurse at school has the medication. So when you're getting refills, get enough refill for all the caregivers. So for the school, you want to give a a packet at the school, keep one at home or wherever the child is. Again, with the medications, they have to be stored properly. Do not just leave them in the car glove box. Again, overeating will make it less effective. So they are specifically like pencil boxes or cases that you can put in the backpack for the child, or at home, like somewhere in the cabinet that's easily reachable, grabbable. So keep it handy, keep it at a location you can find it. And time the seizure, I think that's most critical, again, because you want to use the rescue medicine when it's at time. Those are the final 2 key points that I feel like always come up. You have the action plan, but you don't have the medicine, or you have the medicine, but you don't have the action plan. So they make sure you have everything. Yeah.
Okay, well, we just spoke for an hour about seizure action plans, so I hope that everybody was able to get some great information. Maybe there's some school nurses on the call that are able to bring this back to their schools as well. I'd like to thank Cassie for connecting us with, for working with us on this webinar, and also connecting us with Jason and Dr. Bala. Jason and Dr. Bala, thank you so much for taking the time out today to talk to our participants about the importance of the seizure action plan.
Thank you. Thank you for having me.
Yeah, thank you for having me.
Okay, as I said, this webinar is recorded and it will be on the Epilepsy Alliance America website. Thank you so much, everyone, and have a great day.